Focusing on Ebola crisis, international communities have stepped up their help for West African countries. The International Monetary Fund on Friday approved a total of $130 million to help Guinea, Liberia, and Sierra Leone, the three West African countries worst hit by the virus.
The IMF's executive board said it would immediately make available $41 million for Guinea, $49 million for Liberia, and $40 million for Sierra Leone. In addition, the IMF board approved 25% increases of the quotas of the three countries, increasing their ability to access IMF financing. The 188-nation group also vowed to assist the economic rebuilding after bringing the epidemic under control. The IMF has estimated the economic growth could decline by at least 3 to 3.5% in Liberia and Sierra Leone, and by about 1.5% in Guinea in 2014. The World Bank Group on Thursday said it would provide an additional $170 million of funding to these three countries, pushing its total pledged financing to $400 million. Financing will help them address the emergency and build stronger health systems for the years to come. Meanwhile, the South African Department of Health is seeking to raise 250 million rand, or about $24 million, to coordinate and manage relief assistance for Ebola-affected countries. The organization says that there are several potential candidate vaccines, but the WHO is focusing on two, and the clinical trials of the two vaccines would be accelerated. If everything goes well, the WHO says vaccines should be available for limited groups of people at the beginning of next year. Currently, there are no vaccines or medicines approved by national regulatory authorities to tackle Ebola, except for the purpose of compassionate care.
Many have tried to shut out the virus by closing their borders. Several airlines have stopped serving the three countries. The numbers of ships docking at their ports has dwindled. But such an approach only makes the situation worse, isolating countries when they need help most.
Truly, this is a huge crisis, a health crisis, a humanitarian crisis, as well as, if we don't manage it properly, it would become a peace and security crisis.
Right now, everybody has the best of intentions, but people are not putting in the kinds of resources that are necessary to put a stop to this epidemic. There's still a significant gap between where we are and where we need to be. We know from experience that the response to an outbreak of this magnitude has to be fast and it has to be sustained.
The situation of fighting against the Ebola epidemic remains grim, and it cannot be handled by the affected countries on their own. Time is life, and the international community should take further actions to build up confidence, stay united in adversity, and adopt resolute measures to contain the epidemic.
Our international partners were slow to recognize the threat for what it was. And when the recognition did come, it came with a flurry of fear that led to banning the travel to and from Sierra Leone and our region. This is the very first time Ebola got to my country, Sierra Leone. We did not bring it upon ourselves.
If the scenarios that have been provided to us by the United States Centers for Disease Control come true, and we have over 1 million cases, we're talking about nothing less than the potential meltdown of this continent. So we will now be committing $400 million to the response.
To combat Ebola epidemic, the United Nations has established its first-ever emergency response mission, UN Mission for Ebola Emergency Response.
The setting up of the UN mission for the emergency response to Ebola is clearly a very big step. There's never been anything like this, and we all need to support that. This is an unprecedented outbreak of Ebola, and some of the projections for how it could spread if it's not checked are quite alarming. So it's important to fight it now.
The WHO says more than 6,500 cases attributed to Ebola virus have been reported, with the death toll climbing to 3,083. The organization warns that unless Ebola control measures were enhanced quickly, more than 20,000 people will be infected by early November.